Tester's asked me to chair for the time being, so thank you, Senator from Alabama. I will ask my questions, then turn to Senator Rono, and I think Senator Moran will likely be back by then. First of all, thank you all for serving. Your work at the VA is maybe more important than it's ever been, and I've done about 15 roundtables about the PACT Act in urban areas and rural areas and suburban areas all over the state, and there's a lot of excitement, but there's a lot of ignorance about what it does, so your work and your outreach is especially important. I'd like to address first the electronic health record modernization efforts. Thank Dr. Elna Hall for his visit to Columbus in September. While I didn't see you there, I was recently at the facility with Deputy Secretary Remy and heard firsthand from frontline employees some of the same things you heard about the challenges with Oracle Cerner program. You know all that. I don't need to dwell on it. I'm concerned that the facility's recent sale data could reflect a drop in patient care and satisfaction to the EHR program, causing veterans to seek care outside of the VA. Something we'd prefer not, but if it's necessity to them, it is. We need to address patient care and satisfaction issues. Many veterans may not be aware that the new system has caused issues for medical providers and support staff. You know all that. I just would like you publicly, Dr. Elna Hall, to commit to continuing to work with V-10 officials in Columbus to ensure the facility has the support and the resources it needs to safely implement the new system.
Absolutely, Senator, and it was my visit to Columbus which triggered conversations here with VA leadership writ large around the need to have this assess and address period that we're undertaking with the electronic health record to make the system better for the sites already using it. And I can tell you the leadership and the team down to the front line in Columbus are extraordinary. They want to get this right. It's incumbent upon us to hold Oracle Cerner and ourselves accountable for doing so, and I do pledge that, Senator.
They do want to, but there is a healthy skepticism among sort of all levels of employees. I probably met with 15 in one meeting, 5 in another, and walked through the facility and heard it pretty consistently. But you know that. I just wanted to say it publicly. Mr. Jacobs, as I mentioned, I've held a number of roundtables meeting with Vietnam veterans who talk about their Agent Orange experience. And frankly, we have learned from that, of course, the way that we did the PACT Act. As you know, the PACT Act's named after someone from Columbus. His mother-in-law has been talking to me about this for several years, and Senator Tester and Moran and I have worked on this, obviously, together. I appreciate the steps the VA's taken to inform veterans of these benefits. We need to get creative about how we do this outreach. The VA has to somehow expand its capacity to continue to do what you do, plus expanding the Agent Orange outreach and all the new PACT Act veterans. So I have 4 questions, and of you, Mr. Jacobs, if you would, I'll just do the 3 questions and answer them together. How is expanding outreach to veterans who might not have access to the internet, or younger veterans who have not interacted with the VA, if you talk for a moment about that? Are you working with DOD so service members about to leave know of these benefits? I've found in the past that's not always the case. And is VA planning in-person events at medical centers or in the department open to sending mobile teams to rural areas to expand outreach? We know there are several VA hospitals in Ohio. There are 30 or 31 or 2 CBOCs, and there are veterans that are not even near the CBOC. So talk those through, if you would, Mr. Jacobs.
Great. Thank you very much, Senator Brown. As I mentioned in my opening statement, outreach is a critical priority for us. This law is historic, but it doesn't mean a thing if veterans and their families and survivors don't know about it and they don't know how to apply. There is an active outreach plan that we're executing on multiple fronts. I'm going to ask my colleague John Bursler, who runs the Veteran Experience Office, to talk a little bit more about that, using human-centered design to reach veterans and their families where they are. And we're taking some of the human-centered design insights that we've learned through their work to target our outreach. I'll also say, we have a unique tool that is an isolated execution. So in our New Orleans regional office, we have a database system that is able to identify parish by parish in Louisiana where we have veterans and the percentage of veterans that are utilizing their benefits, so we can isolate our outreach to help identify and fill in the gaps. And often those are in rural, underserved locations. And so we're going to be working to expand that to other states in partnership with the states and other partners. But let me turn to John.
And Mr. Purcell, if you would, thank you. While answering that, just talk to us about when someone comes in to the Dayton VA, say, or comes into a CBOC in Zanesville for something else, what you do about informing them of potential PACT Act exposure and treatment.
Yes, thanks very much, Senator. And as Dr. Elnahal mentioned earlier, we are getting the word out in terms of training more of our frontline staff and clinicians about asking specific questions related to PACT Act and to toxic exposures across the board. So there's literally no wrong door. If you come in for a screening, then you'll be directed to hopefully file a claim and then enroll in VA healthcare. In terms of outreach in rural areas specifically, we have a wonderful program called the Veteran Experience Action Centers, which we've done in Montana, we've done in South Dakota, we've done in Alabama as well. And these are really great partnerships with the state departments of Veterans Affairs, as Mr. Jacobs alluded to, where they're incredibly effective at rural veteran outreach. So using not only those 3-day enrollment sprints where we're focusing on helping them file claims, enroll in VA healthcare, filing their pre-need applications for memorial services, we're also measuring that experience along the way and then tapping into outreach mechanisms that, as you mentioned, if they don't have access to broadband or internet, we're hitting the radio stations. We're using our community veteran engagement boards. We're asking all of our force multipliers at the county and the parish level to help us get the word out. And as Dr. Elnahal alluded to in his opening remarks, we are launching that 80 sites, so VA medical centers and regional offices partnering across the country that first week of December to do this week of awareness, where we're going to have claims clinics mixed in with enrollment sprints. It should be an incredibly impactful. And then finally, sir, I'll mention toward transitioning service members and their families. We just updated the VA Welcome Kit, which is kind of your single front door for information that veterans can get. And the first page that you have in there is our one-pager on PACT Act, and if they qualify based on their deployments and their symptoms. So we're really excited to push that further upstream to those that have not transitioned out of the military yet, as well as sending it to those recently separated veterans and their families.
Thank